Hey everyone. Today I'm going to talk to you a little bit about the epidemiology of substance use within the LGBTQ community. This subgroup has long been recognized to have higher rates of substance use compared to the general population, raising concerns for decades. What factors contribute to this trend and how has it evolved over time? Research indicates that individuals within the LGBTQ plus community are more prone to substance use than their heterosexual counterparts. Studies consistently show elevated rates of alcohol, tobacco, and illicit drug use among LGBTQ plus individuals, though specific figures may vary across different studies and populations. Despite progress in the societal acceptance and legal rights for LGBTQ plus individuals over time, substance use disparities persist within the community. Changes in societal attitudes have not fully eradicated these disparities, emphasizing the need for continued attention and intervention. Regarding preferred substances, LGBTQ plus individuals often report alcohol, tobacco, marijuana, and certain club drugs as commonly used. However, it is essential to recognize that preferences can vary widely among individuals and subgroups within the LGBTQ plus community. Various individual, social, and cultural factors contribute to substance use patterns within this community. Minority stress stemming from stigma and discrimination can lead individuals to use substances as a coping mechanism. Challenges in finding affirming social networks and support systems may also contribute to feelings of isolation and marginalization, impacting substance use behaviors. Additionally, intersectional factors such as race, gender identity, and socioeconomic status intersect with the LGBTQ plus identity, influencing substance use patterns in complex ways. Addressing substance use disparities requires a comprehensive approach. Promoting social acceptance, providing affirming healthcare services, and addressing structural inequalities are crucial steps. Tailored interventions that consider the unique needs and experiences of LGBTQ plus individuals can help mitigate substance use related harms and improve overall health outcomes. It's imperative to delve deeper into these issues, understanding the nuanced dynamics at play, and implementing strategies that are inclusive and sensitive to the diverse needs of the LGBTQ plus community. Through ongoing research, advocacy, and support, we can work towards reducing substance use disparities and fostering healthier outcomes for all individuals, regardless of sexual orientation or gender identity. So, how do we address substance use disparities within the LGBTQ plus community? Like I said, it requires a multifaceted approach that tackles the root cause of these disparities. First, promoting that social acceptance and creating inclusive environments are crucial steps in reducing that minority stress and fostering a supportive community for the LGBTQ plus individuals. Additionally, it is imperative to provide access to affirming healthcare services that address both substance use issues and related mental health concerns. It's paramount. This includes removing barriers to healthcare access and ensuring that healthcare providers are trained to provide culturally competent care to LGBTQ plus individuals. Furthermore, addressing structural inequalities is essential for creating lasting change. This involves advocating for policies that protect the rights of LGBTQ plus individuals and address systemic barriers to health and well-being. By addressing the social determinants of health, such as poverty, homelessness, and discrimination, we can create environments that support the health and well-being of all individuals, regardless of their sexual orientation or gender identity. By understanding the unique challenges faced by LGBTQ plus individuals and addressing the intersecting factors that contribute to substance use, we can work towards creating healthier and more equitable communities for all. Through research, advocacy, and collaboration, we can make meaningful strides toward reducing substance use disparities and improving the overall health and well-being of the LGBTQ plus individuals. Let me hand this over to my partner, Ashley, who is going to discuss prevention.
Okay, so I'm Ashley. Talk about the prevention approaches, the preventative that have been developed and tested for the LGBTQIA population, just specifically in reference to the substance use. And there's not actually a whole lot that I have found that has already been developed. A lot of my points are probably going to hit on Catherine's points as well. We're going to briefly touch on the key components. I'll go over some of those, just things to keep in mind that when we do make these programs in the future, that things that need to be included for that. It's important to note some of these approaches do in fact exist and are thriving. There is a huge lack of services provided for this specific population in regard to the preventative measures. Now, when I say preventative, I'm talking like, the things that are put in place to be proactive against something, not once it's already started. And that's where I was having issues. I was not able to find any type of program or threshold that was aimed at the prevention specifically. But what I did find was with a particular specific population, as we know, different populations often benefit from tailored strategies to help deter substance abuse issues. With the subpopulation of LGBTQIA, we must look at the unique vulnerabilities faced within the community to truly get a grasp on the types of approaches that work the best. We know that peer support and mentorship works really great for this group. It's highly beneficial within this community, and it's effective, and it offers a safe and understanding atmosphere. However, generally these practices are after the effect of use and they're not prior to, which is where I was having issues. They're intended more like preventing relapse instead of preventing use. Members of this population can experience guidance and wisdom for their struggles of people who live similar lives and similar experiences. I found a really neat program called GLAST. Gay and lesbians achieving sobriety together. It's a magnificent, it's just simply peer support. That's all it is. And a resource hub. And it is located in Cincinnati, and it serves the greater Cincinnati area in northern Kentucky. GLAST offers services tailored to the population, and it aims to serve as a support system to break the cycle of addiction by pairing each person with a, and they do 24 by 24. So they put each person that comes into their system, they put within 24 hours, they assign them to one person, and they're with that person for the next 24 solid hours. Another good preventative approach is gender affirming healthcare, like Catherine spoke about. Those services make sure that healthcare for this population's needs are accessed. They're generally aimed at the sensitive needs of the LGBTQIA population. And if we use those and we're able to create safe spaces for these individuals to address things such as the minority stress, like you mentioned, that is just a result of stigma and discrimination and prejudice that they are facing due to their sexual orientation or gender identity. By doing that, we can lower the rate of substance use, but again, it's not much in the way of preventative measures. Therapy would also be rolled into these services, and ideally that is where probably the most prevention, I think, can be put in. There's not really a therapeutic approach already in development, but I think if we were going to try to make one of those, I think it would be really good to start there. We would need to ideally put them with a therapist that specializes in this population for the best results, I think. There's a program called the Pride Study. I don't know if you all have heard of that. It's a study for the LGBTQIA affirming healthcare services, and it has spent years collecting data for this population. And it also provides substance use and mental health issues for these individuals, including substance abuse. Additionally, they're a unique provider for this population, taking care of just as many of those services as they can under one roof. Through this study, they create a safe and inclusive area with no judgment, and in doing so, they create sobriety and optimal health through prevention as well as intervention. This program does it all from testing to treatment, and they support individuals in this community to improve their overall well-being. There is another, I did talk about earlier. Ideally, I would like to think that social media awareness was more active in the preventive, like a social media campaign. Such thing doesn't really exist. Today we're run by online apps and communications through our phones most of the time, so I think that would be a really good place to put that. However, research shows this to be less beneficial with this specific population. When coupled with addiction or substance abuse and recovery on top of the stigma of their sexual orientation, it kind of just rolls into a ball of effect on social media, and it has a more negative appeal for that group. There are groups on social media platforms, but they're, for lack of a better word, under lock and key. They're very specific. They're in groups that are locked down. You have to have specific guidelines and rules to get in it. And a lot of people just stir away from those. Likewise, with so many sensitive topics and areas, sometimes a public eye across a keyboard application is more dangerous than it is helpful. A study by the Human Rights Campaign found that it can be more damaging as it tends to lead to greater risks of abuse, bullying, and it actually shows increased suicidal ideations. Whichever preventative measure is applied or future ones that we are created, it's important to keep in mind the key components. Like I said, we were going to talk about those. This should include communication strategies that are tailored to resonate with the experiences as well as the concerns of the LGBTQIA individuals. We need to ensure that providers of such services are trained adequately and are culturally competent to navigate and increase awareness for this group. I also think that we need to collaborate and build partnerships with organizations and community agencies. We need to share all preventative measures that we have to this group and not kind of gatekeep anything. We also need to head research and conduct research to make sure that preventative programs are working and ensure that if there's ever a need for improvement, that we have the data to do so. By utilizing the already existing or underdeveloped prevention approaches for this community, we're making it essential to address their substance use and promoting health while we continue to strive for the empowerment of these individuals to lead healthier, happier lives. Ideally, I would like to see more programs geared towards substance use on the front lines before these individuals become sucked into the deals of addiction. I think proactive campaigns would be very beneficial. Social media, I know that the research says otherwise, but I really do think it would be beneficial if done the right way. Statistics show that 3/4 of 12th graders who identify as members of the LGBTQIA population have already tried alcohol, nearly half have already used marijuana, and 21% have already experimented with prescription medication. So this is an issue I think we need to be in front of, not in the middle of or behind it. That's my part of the presentation, and I didn't have, like I said, I'm sorry, I didn't have very much as far as preventative measures, but there's really not a whole lot out there that I was able to find. And I'm going to pass it to Cassie.
Hey, this is Cassandra Hughes, and I'll be presenting the treatment portion of the subset LGBTQIA+. So what I found here in a document by SAMHSA is that a lot of the approaches for the LGBT community are based on their treatment readiness and abstinent based. And this was quite surprising due to recent developments in harm reduction and alternative approaches that cater to specific minority groups. However, on this next slide here, there was a breath of relief. The Fenway Institute, as called TFI, is an interdisciplinary center for research, training, education, and policy development. specifically with the LGBTQIA plus people and those affected by HIV and AIDS. TFI is housed within Fenway Health Community Health Center, founded over 45 years ago, Boston-based, a nonprofit, federally qualified health center, and they've served over 30,000 patients in 3 different practice sites. What I found here was a specific curriculum used to integrate evidence-based practice and also clinical application and expertise. And this is a great resource for anyone who is interested. There were different webinars, publications, learning models, some toolkits, videos, handouts, and I have the link included here below. So this is what was found as far as what's offered in Kentucky. There's one location here where they offer the trainings and specific education for giving those quality care to the LGBTQIA plus populations. This mimics a lot of what was presented earlier by my group members. LGBTQIA plus people are disproportionate substance use disorders, and it's believed that it's downstream effect of minority stress. Substance use mediates the relationship between life stress and sexual risk among LGBT people. So what we have here is a framework that these external stigma-related stressors affect their psychological processes, thus becoming an internal stigma-related stressor, which results in behavioral health problems and later physical health problems. This was a specific intervention of 10 sessions for HIV prevention, but it also tailored to LGBT patients due to the minority stress and also the risk of substance use. We have life steps, sexual decision-making, cognitive behavioral therapy, cognitive processing, and then summary of all the modules. What was nice here is tailoring to the LGBTQIA plus patients, both with cognitive behavioral therapy and then also approaches due to minority stress. It was also found to be beneficial to integrate different theories, queer theory being theory that takes position of gender roles, gender identity, and sexual orientation as a construct and self-construct. And then also to go beyond binary gender categories of feminist and gender theory, and to integrate the importance of social construct and how that has an impact on one's identity. Additional topics to explore during treatment: family, societal rejection, social supports, stigma, minority stress, harassment and abuse, person-centered language. An example might be Cassandra, who is bisexual, versus Cassandra is, or she's a bisexual, right? The person comes first. So what I have here is some ways to increase cultural competence and care. I think one of the concerns in treatment was if there aren't specific approaches for an individual, then what can be adjusted or tailored to accommodate. This was interesting and beneficial. So this showed different models from agencies and determined if they were pro LGBTQIA plus treatment or if they were against. And there's a scale here from least to greatest on a 6-measure scale. If provision of care for LGBTQIA plus proves lacking, there's some additional principles that can guide an agency towards better practice. Being flexible, person-centered, coordinated, integrated, comprehensive, consistent with cultural needs and expectations. Promotion of self-respect and personal dignity, promoting healthier behaviors, empowering persons, reducing barriers to service and those hard to reach populations, and work to create a treatment and recovery community. The difference in mental and physical health suggests that additional screening, training, outreach, and integration of healthcare services are warranted to meet the need. Given the disparities described here, it is essential to providers offer services that are inclusive and that services are provided in a manner that is affirming and responsive of unique healthcare needs. So some of the suggestions were to assess for sexual orientation at intake, train staff and counselors, create an inclusive and affirming treatment environment, coordinate physical and mental health care. I liked some of the questions that differed for assessment would be where someone's comfort level was with their sexuality, how open they are about their sexuality, how their sexuality and their gender expression has been received by loved ones and support, all of those having an impact on treatment. So in searching for treatment and support in Kentucky, I went to the Google and found 18 listings, but none of which were specific to the LGBTQIA plus community. Just a variety of those had that they were inclusive, that they were a welcoming environment, but none that catered specifically to the subset. And I did notice a commonality among the majority was that they are trauma-informed care focused. I have some options here in metropolitan areas for specific peer services and 12-step meetings. Covington, Elizabethtown, Florence, Georgetown. And I believe that is all I have as far as my presentation. I'll hand it back over to my group members. Thanks.